welcome back to our 12 o'clock show. We have been relentlessly pursuing the virus, and we have been fighting the virus and educating the masses across the country and across the globe for the last 1 year. Let's go straight to Dr. Shashank Joshi. Shashank, an update of what's happening. And congratulations again for your Mann Ki Baat. And with the Prime Minister, those who have not seen it should go on the net and check out and watch it. Yes, Dr. Shashank.
So thank you, Guru Anna, and good afternoon, everybody. We still are battling COVID, and we are in the peak of the second wave across India. But the good news is that Mumbai is definitely plateauing out, and Maharashtra is showing signs of recovery, and so is Delhi. So we can see the light at the end of the tunnel. So in this week's Taja Khabar, we have a couple of things which I want to talk. There is a drug called Molnupiravir, like Favipiravir, which is undergoing a fast-track review with the Subject Expert Committee of the Drug Control General of India. We also had a drug called Bevacizumab and Baricitinib, which was approved by the Drug Control General of India. Another drug used, which was used by an ex-US president during COVID, a monoclonal antibody which can be injected, was approved by the Drug Control of India. And one drug which is made by DRDO called 2-deoxyglucose was also approved by Drug Control General of India. So in COVID treatment, many more options are going to come across India. We also know that there has been a shortage of oxygen, and therefore oxygen audits, and Supreme Court appointed a 12-member committee in which one of our friends, Dr. Rahul Pandit, is one of the members. We are happy and we congratulate him for that. But obviously the COVID battle still continues. We are still short of vaccines. We have a supply issue there, but you remember that we have to be very cheerful and positive, but we can never be complacent. So as we battle COVID, our biggest challenge today is the large pool of invisible COVID patients, which are asymptomatic, pre-symptomatic, mildly symptomatic, and the COVID timetable of 14 to 21 days, they suddenly deteriorate from day 7, day 10, day 12, and then they'll end up in the hospital. Picking them up and sieving them out, saving their lives is our primary target. So currently our focus and battle is on India is battling. We also have some news on the vaccine front. We clearly know that Serum and Bharat Biotech have upped their production. We also know Sputnik has arrived in India, and we also know that Zydus COVID-D is also getting available. The third wave preparations have started in Maharashtra. There is a pediatric task force headed by Dr. Suresh Prabhu. They are looking at the children's care. I have to congratulate Dr. Guru Anna also. He's going to be part of that whole strategy which is going to take care of children, their schooling, because the third wave might impact them, and that will have huge implications on schooling and their mental health. So that's going to be the next wave challenge. But currently we are still in our second wave, and the big thing is, at last, the Center for Disease Control, Atlanta, Georgia, as well as the WHO, has accepted that COVID is airborne. I think it's been taken them almost a year. There has been a huge aerosol controversy. If you go on JAPI website, Journal of Association of Physicians website, I have written a editorial which you can all read. It's a medical editorial on the variants of concern and airborne transmission of the COVID second surge. And that's something which we are all fighting, and that's something which we all need to mitigate. So it's important that we handle this wave well. We can never be complacent. Maharashtra is still struggling a little bit, particularly rural Maharashtra. We have oxygen shortages, we have bed shortages, but we have to ensure that our healthcare infrastructure is ramped up. Good news from Maharashtra is that there are more than 19-20,000 posts in public health department which are vacant. They also will be filled up very soon. So obviously we can see some ray of hope, but we cannot have a degree of complacency. So Guru Anna, I think we need to really recognize two things. One is that at last we are seeing some light at the end of the tunnel, number one. And number two, we are hopeful, but we don't want to be complacent. I take this opportunity because today is Mother's Day. Of course, all these days are coming from the global world, but we recognize our mothers. We are what we are because of Mother Earth, and we are what we are because of our mothers. So I give my pranam to my own mother. All the mothers who are there listening to us, we salute you for whatever you do for your children, and stay strong, be happy, and virtually nothing is impossible in this world. if you just put your mind to it and maintain a positive attitude. And that's something which we know, and that's something which we recognize. You're muted, sir.
There's a lot of news about fungal infections, and there's a lot of bites and words thrown across all the media platforms. And unfortunately, there's a scare of the same. Can you put the record straight of why, what, where, how, when, who?
So there has been a tremendous WhatsApp activity on something called as a black fungus, or the mucormycosis. And remember that this is a very rare and ultra rare fungus. Usually when we use steroids and when you have diabetes, you get this unusual occurrence of fungus, but we are seeing it across Maharashtra. We are seeing it, and it needs rational use of steroids. So we are very clear about our steroid uses. Don't use steroids early at all in the disease. Number one. Number two, use steroids only in moderate to severe cases, those who need oxygen. Number three, use steroids in the right doses. So methylprednisolone 40 milligram twice a day or thrice a day at best. Don't increase the dose at all. That's not evidence based. Or 6 milligram of dexamethasone or its equivalent doses. And only for 7 to 10 days, taper it under medical supervision. Do not keep using high doses. And if the person is using steroids, they are likely that their glucose will go up. So monitor the glucose round the clock, give insulin, and keep your glucose normal. The steroid use with high glucose is a perfect recipe for unusual funguses or parasites to grow, and mucormycosis is one such parasite. More important than that, apart from steroid use and sugar control, is taking care of our nose, throat, and mouth. Because if you want to prevent mucor, you just can put some nasal spray, put some betadine drops, or put some throat gargles with betadine or povidone iodine as they call it. Do proper gargling. So if you do a proper jalaneti, which is just cleaning it with water spray or saline spray, ensure that you gargle your mouth every day. Ensure that you do some throat gargling and mouth cleansing every day. You can actually prevent this mucormycosis. And this is particularly true because COVID timetable in acute care, I told you, is 14 to 21 days. But COVID recovery time total is 3 months. So you need to take nose, throat, and mouth care for a good 3 months, particularly if you are used steroids during COVID or if you have diabetes. And that's where this unusual fungus comes. And if there's any challenge related to that, immediately go to your doctor. Usually we send them to the ENT surgeons, and they are seeing definitely a spot of mucormycosis. You're muted again.
One, Dr. Shang, one of my friend had suddenly something known as surgical emphysema, and there was air in the lungs. And slowly he recovered and went home, and he had to be given a lot of chest physiotherapy and has come back to normal. What is it? When does it occur? Why does it occur? And how this should be actually treated? Should the relatives be very scared and tense about it because the length of the stay in the hospital increases?
They should not be scared about it. This can occur because of recurrent cough. When you get recurrent cough, you can get sometimes a little bit of surgical emphysema. And that emphysema can sometimes lead even to a pneumothorax, and sometimes may also need for an intercostal drain to be put in. But usually the lung expands after that, and usually in a couple of weeks, somebody is able to go home. So this is something which we see quite often and reasonably commonly. And this is something which we need to be mindful of, careful of, and we need to ensure that we are able to handle it well. There is nothing to panic. Under care of good nursing, good physiotherapy, and overall care, it does well. See, remember the main thing in COVID care is all about symptomatic and supportive management. So if the fever is going above 100, don't wait. Take the paracetamol round the clock. There's no harm in taking it. There is absolutely nothing to worry, because the normal the temperature you keep, the lesser will be your heart rate. Because as the temperature goes up, heart rate goes up, and then anxiety builds up and everything builds up. So keep yourself on probably under medical supervision, some amount of paracetamol round the clock. Then the other thing which is very, very persistent with COVID is dry hacking cough. COVID gets dry cough, and that dry hacking cough can occasionally lead to emphysema or a spontaneous pneumothorax. That's something, and sometimes even rib fracture. I've even seen people and they get acute pain due to rib fracture. So that also needs to be tackled appropriately and correctly. So that's something which we need to also recognize, that we need to keep doing that. So we have a couple of issues here and we need to handle them with care. The other thing is, in the hospitals, we often tell them to put a pillow below their chest and sleep on that pillow below the chest, because it's called as prone position. And keeping proning all the time, particularly in the critical care units, ICU units, is very, very useful and important, because it improves the oxygen intake and opens up the lungs. See, it's all about opening up your air sacs. Our air sacs are called as alveoli. Normally our lung is expanded up to 60%. If you want it to be fully expanded, then we need to ensure that we do pranayam, you breathe some good air, fresh air. Atmospheric air has 21% oxygen. If you put them through some filters, you can get almost 90 or 100%. And it's all about oxygen today. So obviously, when you are looking at a breathless state, we need to detect that occult hypoxia, or the hidden low oxygen saturation. And that's the only thing is the red flag. If you are managing somebody at home and if you want to pick that up, that's the only thing. So Guru Anna, there's absolutely nothing to panic. This surgical emphysema comes and goes, and most people are able to recover.
So the air is around the lungs, or air is between the lungs and the rib?
It's basically trapped in the subcutaneous tissue.
Okay. Thank you. Now, you know what? A lot of people are waiting for the vaccines. The second dose has been really delayed for a long time, though it's not no fault of anybody as of now, because vaccines take a long time to manufacture. And there's a lot of anxiety. If they take the second dose very late, what will happen, and why is all this happening? And there's fear of fear. If you take the second dose late, we might get infected, and so on and so forth.
Absolutely true. So vaccine, remember a couple of things. If you have got Covishield first dose, and even if the delay is up to 3 months, it is okay. So there is really no need to panic. Okay. If you have got Covaxin, and even if there's an inordinate delay up to 45 days, do not panic. Because the point is, one dose, something is better than nothing. And of course, you will get your second dose. So I'm not saying that don't worry. As far as Covishield is concerned, the ideal time is 1, 2, and 3. Wait 1 month after the first dose for Covaxin, 2 months for Covishield, and 3 months after you have got COVID or you have had a vaccine-induced COVID. So that's the real formula. But if you are not able to get Covaxin on time, you can go for a month and a half to 2. If you are not able to get Covishield on time, from 2 months, you can extend it up to 3 months. It is absolutely okay. We understand there is a supply issue. The various stakeholders in the government are trying to mitigate that. But by the time that mitigation occurs, by the time your number comes, do not panic. Okay, wear double mask, stay safe, and be very, very crystal clear.
But will the will the vaccine be effective if it's taken a little late?
In fact, it may be surprisingly, Guru Anna, it might be actually more effective, because the second immune response may be more robust, and that second immune response might be actually better. So in Covishield, there's data to show that the longer you delay, actually the immune response may go up by a few percentage points. So that may be useful. As far as Covaxin is concerned, probably you should take it on time, and we should try to avoid the delay as much as possible. And the same will hold true when Sputnik arrives. So every vaccine has its own profile and its own duration and how it has to be taken. Also remember, if you already got COVID, don't rush to get the vaccine, because after you get COVID for 3 to 6 months, you're going to be safe. So remember that, let somebody more worthy get the vaccine, and you don't need the vaccine ASAP. You probably need it a little later, because remember, your active COVID is over, but your chronic COVID is still there. You are generating some antibodies, and then probably the vaccine will be useful. So maybe a month and a half to 3 months is the optimal time. 3 months is the ideal time. Some people wait even up to 6 months.
If D dimer is normal, then is it necessary to take anticoagulants? Dr. Chavan is asking this question.
See, the D dimer is a very tricky test. We don't give it to everybody. Somebody has a high cardiometabolic risk, then only we give low molecular heparins or oral anticoagulants. If D dimer is normal, I may not give. In fact, most people we don't give unless they're hospitalized. So in a non-hospitalized situation, unless somebody has hypertension, heart disease, diabetes, then probably we give a low molecular heparin. And if the D dimer is normal, we may defer it.
Any guidance to dentists once they join the clinic who are recovering from COVID and after quarantine would resume their practice? What care and precautions should they take?
See, dentists, ENT surgeons, and ophthalmologists are in direct contact because of the orifices from where COVID is transmitted. So obviously they should still wear an N95 mask, and wear a face shield because they have a lot of secretion which are emitted, wear a headgear, and presume every patient as potentially infectious. And ensure that the biosafety guidance for the clinic is done. Air ventilation is the key. Have an exhaust fan in the clinic. Ensure that there is a continuous circulation of air so that the virus doesn't stay resident in the clinic. So having appropriate ventilation and appropriate exhaust fans is the key in a dental clinic. Over and above that, taking personal protective measures. So those are the two keys for dental surgeons. Dental surgeons are more vulnerable for getting it. So are ENT surgeons, so are ophthalmologists.
That was Sonali's question. Mamta is asking, patient is discharged after moderate to severe COVID, but still complains of remittent type of fever and weakness and saturation between 94 and 97. Clinical improving, but loss of taste still exists. Is there any fear? Is there any anxiety?
Can you repeat the question again, sir?
Ms. Mamta Kal is asking, patient is discharged after moderate to severe COVID, but still complains of remittent type of fever and saturation between 94 and 97. Please guide whether this patient is please guide. Patient is improving, but there's still loss of taste still like this. Antibiotics is for the physician to decide because we have not seen those patients. Let the physician decide. Yes.
Very common thing: persistent fatigue and persistent fever. The fever sometimes I've had patients which has lasted for 40 and 50 days, and that is a post-inflammatory high-grade fever or low-grade fever in the evening. So it could be an inflammatory fever. We do a CRP and a PCT. If the PCT is low and CRP is high, then obviously it's a different scenario altogether. But if both are high, then it's infection. So that's number one. Number two is that fatigue is also very common. So usually in the post-COVID syndrome, in the long hauler syndrome, we do tend to get a little bit of fever, which is persistent. We normally try to rule out an underlying infection because it could be very common that it could be underlying not only just a fungal infection, it could be underlying bacterial infection, it could be underlying skin infection, it could be underlying viral infection of another nature, or it could be underlying parasitic or fungal infection. That's number one. Number two, persistent fatigue is extremely common post-COVID, and it can last as long as 3 months. So we treat it case by case. We ensure that nutrition, overall chest physiotherapy is enhanced, and if appropriately guided through cultures and blood work, we then may sometimes give antimicrobial therapy. But every fever post-COVID may not be infective. It could just be inflammatory. It could just be an autonomic reaction. See, a lot of people get two things: a little 9900 fever by evening, and also a little fast heart rate, which is called as sinus inappropriate tachycardia, which is often seen in post-COVID syndrome. You're muted, sir.
Is it essential to buy oxygen as a prevention at home?
Not at all. Please don't hoard oxygen and medicines. I would not recommend it. But somebody has COVID and if the person is breathless while getting discharged at home, and if doctor wants you to take 2, 4, 6 liters of oxygen at home, particularly at night, it's called as nocturnal oxygen therapy, then it may be worthwhile buying a concentrator or a device for oxygen. But otherwise, there is no need to keep oxygen at home.
Fantastic. Also, at times, people are asking this question that once you're recovered from COVID, should you do a general health checkup and look at all your organs all over again?
Well, I think maybe after 3 months, overall body checkup is needed, because often we have seen in COVID, we have discovered those who had never got diabetes have got diabetes. Sometimes they have picked up blood pressure. Some of them have got lung involvement. Some of them have heart involvement. Some of them may have a weaker GI tract. Some of them might have lost their smell or taste. So obviously we need to monitor them. So it may not be a bad idea under medical supervision after 6 weeks to 12 weeks to completely undergo a proper checkup before you get your vaccine dose.
Thank you, Shashank. Can you give us some tips as you are leaving for the next week? What should one do for the next week, 1 week? Because you're the person they all listen to.
No. I think, Guru Anna, before I ask you the questions, the first thing which I request everyone to do is we are still not out of the woods. So don't be complacent. Now everybody wants to go out for a walk. Everybody wants to go out to in the park. Everybody wants to go on the road and ease out. Everybody is restless to go back to their offices. Look, this sacrifice to stay home is to save ourselves and our brothers and sisters. So I think we need patience, we need resilience, and we don't need to panic. Number one. Number two, do not get panicked with these high numbers and all the negativity around you. We need to stay negative but generate positive news, and we need to not get positive and ensure that we are negative. So that's the second thing. The third thing is, even if you're going out, either wear an N95 when you're going out, but that's very, very expensive. It's medical. So then at least wear a double mask. Even if there is nobody around you, if you are going to talk, sing, walk, and talk, then you need to have yourself masked. So have a simple three-ply surgical mask covered by a simple cloth mask. Protect yourself. So my only request to everybody is protect yourself. Self-protection, self-isolation, self-introspection, and being Atmanirbhar is the key. So Guru Anna, I think, one thing is very clear, that we need to rewire our minds. But, this is getting too long. So, I want to ask you a question, Guru Anna. That what is it, this fatigue which has set in, the protracted negativity of COVID, it doesn't just seem to end. It is relentless. This wave has been relentless. It has been cruel. It has been very devastating. It has been ferocious. It has been tsunami-like. These are all those words which are surrounding it. What has happened? People are in shock and awe. And the shock and awe is of fear, panic, negativity, and they are stunned. Because the first wave, we had some degree of sensitization and we had some degree of adaptation. Then we went out in a reckless way, a revengeful way. And now what has happened is we are in a shock and awe. We just don't know what has happened. We are just at home and we just don't know what to do. Because not only there is mental anguish which has set in, but also some degree of uncertainty has got amplified. When amplification of uncertainty happens, when there is adversity, when there is negativity, and when there is no hope when things will be okay. Okay, we really don't know what's going to happen. Guru Anna, you need to tell us those Guru mantras, how to keep yourself going when there is so much of uncertainty and adversity.
The most important thing is none of us have all the answers, but let me tell you one thing, that if anybody says that he has no fear at all, that means he's lying. If anybody says I can face any fears, he's denying the existence of fear. And if anybody says I'll face it and I don't care, that means he's becoming reckless for probably an infection which will land him into real trouble. So what is very important is accept reality as it is. When you accept reality, a lot of anxiety actually goes down. Number two is that let us all believe that we're living one day at a time. And when you live one day at a time, you try and experience the good things of that day. You try and experience the good morsels you have inside your food. You try and experience the good interactions you have within your family, between your friends, and just one day at a time. Sometimes you have to live 1 hour at a time and 1 minute at a time. And that, I think, breaks that anxiety of tomorrow, yesterday, and day after tomorrow. The fourth most important thing is in that one day, you'll get a lot of information, good news, bad news, good news. Somebody recovered, somebody died, somebody got infected, somebody got transferred, somebody is in ICU for a long time. And let the news come. Don't block the news. But do one thing which is very important is let the news come and let the news go. And if at all you have bad news, I'm going to answer that again. If at all there's bad news, there's something we need to do, which I'll answer a little later. The fourth thing, which is very important, is don't spread bad news, but spread good news. Spread the good news, but don't spread bad news. But at the same time, if you have to share something, don't share that with shock. Don't share difficult news with a lot of sensationalism. The difficult news should not be a part of gossip and should not be part of passing your time and having a discussion around it. I lost a teacher in my school, Uma teacher, a primary school teacher, brilliant lady, and we are all shocked. We're actually all shocked. But what is important is when we're all shocked and sad, we all are healing ourselves together. When you're sad together, you heal together. And we're all talking about all the good things she has, all the good moments she had in school. and all the good qualities she had. Though we are shocked, we are looking, automatically we are focusing on all the good things. And when we are sad together, we are recovering together. So I think these are the things. But if somebody says, "Mujhe kuch nahi hota hai, malakai hot nahi," that means lying. Mala hoto hai, but I'm swimming, my head is up in the water, but I continue swimming, and I don't swim alone, I swim with everybody. And swimming alone in a disaster is dangerous. Swimming along with the sea of humanity is the best way to survive this disaster. And let's respect people who have gone. Let's pray for the souls who have gone. And prayer not only helps us, but prayer helps the entire sea of humanity to really survive this entire crisis. So let us sing a song in a heart for all those who have gone, and that I think is so important.
Thank you so much, Dr. Shetty. Another question that has come from one of the viewers is related to what you just now said is Mika Kapoorji says, we are seeing so much unfortunate news all around us. It's all good and well to say that stay positive, but is it even possible to smile?
I think fantastic question. Fantastic question. It's not essential to smile when you're not required to smile. And when you hear bad news, for example, when you hear death of somebody whom you knew, whom you know, and whom you love, and whom you care for, remember, don't become an inquiry officer. Don't become Sherlock Holmes also. Don't inquire about the small details, which will become a Chinese whisper, to find out what you could do at that time and what you could do to prevent your own demise or death. No, don't look at which doctor it was. When you do all this, you don't recover. So when you grieve, when you have little empathy towards somebody who has passed away. Empathy is always unequal, isn't it? If my son is unwell, I'll take him to a pediatrician. But my neighbor's son is unwell, I'll give him the address of the pediatrician. Empathy is always unequal, but empathy has to be there. So if somebody has lost his life or her life, remember one thing: sadness is also a part of healing. Condolences is a part of healing. And so when you have an iota of empathy towards the grief and the loss of somebody, you are healing along with the person who's a loved one. And when you share the condolences, you also promote healing that person. So sadness is the beginning of healing. But being Sherlock Holmes is only means that you're killing your empathy and you become apathetic. And in the globalized world during the pandemic, antipathy and apathy is also seen, which can exhaust your empathy. So keep your
Hmm.
empathy alive. Even if you feel a little upset, accept that it's normal, and that's the first step for healing.
Excellent. Wonderfully said, Dr. Shetty. One more question that was we're seeing this bad news and it's unfolding in for a lot of people, unfortunately, in front of their eyes. While they are caring for their loved ones, they are seeing other people who are suffering right next to them. So Mayank Goswami was asking, how should bystanders manage this bad news and how should they handle it?
So let's go to the person who has lost a member of the family and what he or she should do. For all those who have lost somebody in your own family, your mother, father, or your sister or brother, I understand that you may have cremated him or her alone or with a few people. I also understand that you had little time to grieve. You're shown the body to identify the body because after death they call it a body. They don't call the person by the name, unfortunately. And then you have to relay the cremation to your close relatives on Google Duo or on WhatsApp video or on Zoom. And you have to do that with tears rolling down your eyes. And as you do that, what is so important is when you come back, remember three or four things which are very important. Probably because you're the head of the family, you may postpone your grief so that you get things moving. But don't postpone it for too long. I still remember this man who said that I have not yet wept for the death of my wife because I have three kids and I have a grandmother, I have a mother-in-law at home, and if I weep, they'll all break down. I said, no, not at all. What is so important for you is to get back and be human. And if you actually weep, they'll all understand, and they'll all accept that you're sad, and it's perfectly normal. No child wants to see a Superman in the house as a father. Child wants to see a man and a human being inside his father. And similarly, the mother-in-law, the mother of your wife or the children would not grieve in front of you, believing that they might hurt you and they might cause you a lot of damage. And they should also understand that it's okay to cry and weep. And this will go on spontaneously for a long time. And if it continues, remember one thing: crying is liberating, and a family that cries together heals together. I said that so many times that I believe that I have to repeat it. Laugh without reason, but cry without reason, and that is number two.
Mm.
Number three is also is that probably once the corona abates, you might go and talk to your doctor, take an appointment, and find out what exactly happened towards the end. How
Mm.
was she? And that also is so important. So visit to the hospital where she passed away. People avoid the hospital for their life. Mala to hospital bhagwat nahi. Not at
Right.
all. Go back and do something. And as you have time, please finish all the rituals which you're supposed to do now. And honestly, all rituals after the demise is aimed at healing the relatives, not
Mm.
only at providing a space in heaven for your lost one. Lastly, please keep away from hyper curious relatives and individuals. You have a right to your mental health, and there's no need for you to please everybody by repeating the story again and again to everybody. Those who respect your privacy, those who respect your space, are those who can get into your space. Those who do not respect your space, and those who want to know each and every word of what happened, please stay away from them. And as you do everything, finally, you see to it that you do not hide the person's photograph in the house, but you really display it. And when you cry frequently, you quarantine the memory, and also you also look back at all the good things of the person. That is the best guarantee for all of us to feel. Sorry, I'm a little long, Anirudh. I
No
understand that
problem. No.
you feel why I'm a little long. There's another aspect of it is survivor guilt. A lot of people, I still remember this couple was in hospital. They were all about 70. The wife survived and the husband died. The wife came
Mm.
and continuously shared, "Why am I alive? God should have taken me." In
Mm.
India, all women who are married believe that they should not outlive their husband, and that's a philosophical thought. And this guilt is so severe. Why did I live,
Mm.
survive? Why escape with little pain and distress in the disaster? That is something very difficult to deal with. What is very important for us to understand that sometimes life is beyond science. Maran Jivan Maran
Right.
Vidhi Hath, they say, and allow the guilt to spill in on the plate, and as it spills on the plate, reassurance that God wanted you to be here, or you have survived to see all the good things what your husband actually desired you to see, and you are there so that we're all happy that you're there, and that's just by chance. So survivor guilt needs to be understood, should not be blamed on the person, and it's not an irrational comment. It will decrease if you understand
Right.
it, if you allow it to spill, and things come back to normal.
Wonderful. Thanks for making it so relatable, Dr. Shetty. And from the guilt and the suffering of the ones who are actually going through this, there's an equally larger number of people who are at home and are extremely anxious. They're anxious by seeing the news reports of lack of oxygen. We just had one viewer that you just asked a question regarding keeping oxygen at home. So this whole anxiety that will I get oxygen, will I get remdesivir, will I get a bed, will I be able to actually make it if I do get COVID? So how do actually people deal with this extreme level of anxiety And are there any practical tips to get it down?
Absolutely. Number one is, will I get COVID? Yeah, you can get COVID. Simple. You can get COVID.
Right.
Will you be able to face it? Yes.
Hmm.
If you do not build pictures of yourself in the hospital, if you do not build pictures of yourself in the ICU with oxygen, accept that anybody can get COVID, but the probability of you will be much less if you follow the guidelines. But probability is less, but you might just
Hmm.
drop your guard for a second and you might get it. Once you actually get it, the people who actually survive are those who seek immediate help and not treat themselves at home and follow the guidelines as practice. So immediately you need to talk to your doctor. But the anxiety that will I actually get it? And if you accept that, yes, I may get it, anxiety, half of the anxiety goes down. The second half of the anxiety goes down and you tell yourself the facts. Facts bring down anxiety. Fact one, 85% of people get well inside their homes, the rest need hospitalization, and a small proportion of patients don't come home and they go to heaven. And those facts also help you to bring down your anxiety. Number three, telling yourself that you're actually vaccine 1, vaccine 2, vaccine 3 inside the house. Probability is much less. Number 4 is, as I've said earlier, doing small things at home continuously provides a
Hmm.
space. It's not only a distraction, provides a space to bring down anxiety. Also, managing your breath work, which I call, and people are ashamed to call it pranayam somehow. I do not
Hmm.
know why. But pranayam actually brings back your sympathetic, parasympathetic nervous system into a complete alignment, and aligning your mind and body with the universe also brings down anxiety. Laughing off your anxiety is also important. Salah, main tapak gaya to, and you laugh about it, and there's somebody who jokes about it, and you all
Yeah.
laugh about anxiety, and humor also dissolves a lot of anxiety, but a little hypervigilance is
Hmm.
essential, is healthy in the time of disaster. Hypervigilance is to protect yourself and not be
Correct.
so hyper alert that you are not able to deal with the world around. You're not so hyper vigilant that you are not able to experience emotions of joy
Hmm.
and laughter.
Excellent. Excellent.
Hypervigilance is very, very adaptive.
So it is fine to be a little anxious, and it's not completely abnormal in the current situation. Is something.
Absolutely. So the measure of anxiety is something which is very important. And if you're extremely anxious and you can't do something,
Hmm.
no issues, no hassles. If you reach out to a counselor instead of an astrologer, or to reach out to your family doctor, that give you a
Hmm.
small pill to deal with your anxiety immediately. No harm in taking pills at all.
Right.
A lot of people say, इसकी आदत हो जाएगी.
Hmm.
यार चश्मा पहनते हो ना, आंखों को संभालती है. See, Anirudh is wearing a चश्मा, आंखों को संभालती है.
Yeah.
गोली है ना, दिमाग को संभालती है. जरूरी है तो लेना चाहिए.
Wonderful, wonderful. Miss Pranita, she is a principal in Navi Mumbai. She's asking, Pranita Shindaji, school children are suffering highly in this second wave. Are there any practical tips for the parents as well as for the teachers? And also any special tips for hyperactive children who are dealing with these Zoom classes and are finding it really difficult to be in one place?
Vacations are on as of now, and only the 10th standard and
Yeah,
the 9th standard are attending tuition classes. Tuition. I don't know
right.
why this entire practice started a few years ago. When you start
Correct.
doing 10th standard in the 9th standard,
1 year below. Yeah.
you finish the chapter, you finish all the portion, and you have to do 3 times revision.
Three times.
No state board checks the abilities of children. They are just a promotional exam.
Hmm.
All the questions are from the books. There's no
Correct.
applications are very less, so it makes no difference. During my time, we did not do 10th standard question in the 9th. So it is a dash myth. I don't want to say what is the dash myth to hassle children in the 9th and the 10th during the vacation. You can finish the entire portion once by December. Doing the portion once is enough, and not doing it thrice. That is number one. Number two is, I'm proposing to the government, I'm writing a
Hmm.
protocol for schools starting.
Okay.
Revolutionary, isn't it? I'll tell you what.
Hmm.
In my mind, I feel children need socialization. Schools are not only meant to teach mathematics, English,
Correct.
science, and chemistry or languages. School is a place where socialization is important. So my protocol says that let every standard come to the school once a week. They'll occupy the entire school so that there's
Enough
distance. You have
space.
2 hours of school, 2 hours of school, 1 hour of some studies which are very important, 1 hour of fun,
Hmm.
so that they laugh with each other. Though you need to sanitize the school and you do the RT-PCR of every child when he comes and the teachers, and you
Hmm.
need to take permission of the parents if they are willing. So imagine 2 hours of school every week is also a good break for children. We do not know when we can wait for the pandemic to actually get resolved.
Right.
So that is one protocol. Second, there's a lot of physical activity in school when they come. Say, for example, a school starts with the fifth standard at 8 o'clock in the morning and they go at 10,
Hmm.
and 1 hour gap at 11 o'clock, the sixth standard
Hmm.
comes. So two standards can come on a day. And so they could have probably 2 days
Wonderful.
in a week in school, and that is important. Also, when we think about school, remember, think about teachers. Teachers have passed away. School principals have passed away.
Yeah.
The spouses of teachers and the principals passed away. So we need to actually be completely empathic towards the entire ecosystem. You can't
Hmm. Hmm.
demand from teachers everything,
Correct.
and all amount of empathy. Remember, when the children empathize with the teachers, teachers get healed. When teachers empathize with the children, they get healed. At the same time, Anirudh, the kids would have lost their parents.
Yeah.
They would have lost, had families who have lost their jobs. They would have lost their friends and their neighbors. So the circle of empathy is what we should focus in schools. Education can wait. कुछ
Hmm.
नहीं होने वाला पाइथागोरस नहीं आया तो कुछ नहीं होने वाला if they do not know the capital of Jharkhand. कुछ नहीं होने वाला if they don't know how to make chlorine in a lab. Education can wait. Life cannot
Hmm.
wait. Joy cannot
Yeah.
wait. If you manage the mental health of children, they'll catch up with their education. The brain
Yes.
has tremendous power. So please, all school teachers, don't be addicted to chachani. Don't be addicted to the aspiration. Addiction to the aspirations of the child is also very dangerous.
Hmm.
अरे यार 2 घंटा बुलाओ 1 घंटा सिखाओ 1 घंटा पूछो तुमने कैसा बिताया ये दिन and you will get lessons of resilience from children. Anxiety is as more infectious than the coronavirus, but resilience is also very infectious. When children share what they did to beat their anxieties, parents will learn, teachers will learn, and let me tell you, there'll be a revolution. Socialization is a must. School children should come back to schools in a graded fashion, and we need to be very creative of starting the schools. And at the same time, when I share this, we also would admit that the children with disability need to have a different protocol. The first is that they need to understand that if the children with disability have a COVID, what is very important for us to understand that they need their remedial educators or their guardians or their helpers should also be allowed in the ward, because nurses and housekeeping staff do not understand the behavior of the children with disability. So they need to allow
Hmm.
that. Sometimes they need to allow the mothers to be in the COVID ward. Children with disability should get priority in the admission to a COVID ward. Having said that, all special schools should start ASAP with
Hmm.
all the protocols, because children with disability are having a hell of a time, and
Hell of.
parents also are having a hell of a time. So we need to prioritize special schools to start first, then other schools. But I have a protocol to start schools in spite of the disaster, and
Wonderful.
let's begin schooling. I do not want to play safe. The biggest philosophy in India is playing safe, because no school will start. कुछ हुआ तो हमको blame करेगा. अरे
Hmm.
यार पासा फेंको. Think about the 99% of children who should get healthy. 1% can get COVID, but we'll take care of it. Playing safe will destroy children. Playing
Hmm.
safe will retard the health of the children. Playing safe will retard the education of children.
Excellent. What a wonderful thought, and Dr. Shetty, we look forward to those that protocol and we'll let our viewers know when it's out. There's one question from children to the adults now. Darshan Rautiji is asking, ki with another lockdown-like situation, there's more and more lethargy. I'm ordering food online constantly, working from home for more than 12 hours, and there is just no exercise. Now, how can I get motivated to exercise at home?
Well, I was told by HR from a financial company, financial services, don't tell
Yeah.
us about anything about meditation.
Yeah.
Don't don't tell us anything about yoga. Don't
Hmm.
tell us about an hour of power. I told him very clearly, we have lost money in our company and we've had to get back all the money, 8,000 crores. I told the gentleman, if you do all this, you'll be effective. And effective, when you're effective, you'll be able to do 2 days work in one day. And if you're able to do 2 days work in one day, you'll be able to get 8,000 crores back in a few months.
Correct.
If you destroy your mind, your organs will cry, the stomach will release a lot of acid, the liver will misbehave and get enlarged and not throw all the toxins out of the body. The pancreas will cry and say, I will not give you insulin. The calcium traveling across the arteries of the blood will stay in the arteries of the heart and say, I will not move from here. So you know what you're doing? You're shortening your life and you're destroying your company. When I said that, he was taken aback and invited me to conduct a session in his financial services company. So all this myth that I should overwork and do more work is stupid. Look at all the successful people. They do more work in a given period of time because they're effective. In life,
Yeah.
it's not important to be good. It's important to be effective. And I did my pranayam in the morning. I'm going to start my exercise all over again because it had a break. And to be effective, you need to have the right balance of the sympathetic and the parasympathetic nervous system. And when they're aligned, you align to the universe. Align yourself to the universe to be effective.
Wonderful. Wonderful. With that, I would just ask Dr. Shetty if you can just give a closing comment on what people should look forward to in the coming times. Definitely, we are seeing a little bit of a dip in Maharashtra and Delhi, but the rest of country is still reeling through the effects of the pandemic. So, is there a ray of hope in all of this?
Well, let me first thank Anirudh Sapatnik. He's the SA node of our show. If doctors are here, you would all know SA node is the node in the heart which keeps the heart beating. He is the alpha, beta, theta, delta waves of the brain. If you know that, if you take a graph of the brain, there are 4 waves, energy of the cosmos, which keeps you alive. When you're dead, the electroencephalogram becomes flat. And I'm really grateful for all what you're
Thank you.
doing, all of us. You are like the silent chest physiotherapists who have
Yeah.
been underreported, under-recognized,
Hmm.
not heard of and not understood, and we are going to get them to the show in the
Yeah,
next
absolutely.
Sunday. I would say that the chest physiotherapists
Hmm.
are as important or more important than the physicians who are treating the patients, the nurses who are treating the patients, and the housekeeping staff who are treating the patients, and all the members of the task force committee.
Hmm.
Let us look at them with compassion. Let us get them to speak
Yeah.
so that the world understands what they're doing. And let us recognize this profession to be one of the most important lifesavers of all the COVID victims. And they have been working hand in hand inside the COVID ward. Young physiotherapists, like the young Kargil soldiers who won Kargil for us, these are the young girls and boys who work in the hospital. We would want to get them on the show. With this,
Absolutely.
Anirudh, I do not know what to tell you, what to say, but let everybody understand that we are the 3 amigos, 3 musketeers of the show. That's Anirudh Sapatnekar, Dr. Shashank Joshi, and Dr. Harish Shetty, and we'll relentlessly continue our education across time. Thank you, all the viewers. There are a lot of questions unanswered today, and they will be answered in the days to come. We'll not leave any question untouched or unanswered. Happy Mother's Day.
Absolutely.
Don't irritate her today, at least. And if you hug her, she might say, Mother's Day वगैरह क्या मतलब माँ इतना है वही. And let her understand that for the West, it's one day is Mother's Day. For India and the East, Mother's Day is every day. Thank you.
Thank you so much. Thank you so much, Dr. Shetty. Thank you so much, all the viewers.